Hello, everyone, and welcome to another episode of Random Health-ish. I am your host, Dr. Gloria Stone-Ozbek, and tonight we have a very special guest. We will be diving into the topic of mental health. So please join me in welcoming Miss Salma Abdalla.
Thank you so much, Dr.
Yes, welcome.
Yeah.
I'm so excited to have you on tonight.
Thank you so much for having me.
So, Salma, tell us a little bit about who you are and what you do.
Sure. So my name is Salma. I live in Texas, Dallas. So my expertise are public health and mental health. I do have a master's in public health, and I've been working in the behavioral health field / mental health field for about 7 to 8 years now. It's so hard. Like I thought it was a couple of years, but it has been long. And so just working with individuals who have mental health, depression, anxiety, bipolar disorder, etc. Pretty much, low population individuals who are underserved. And currently, what I do is I work as a community care coordinator, and I do work with the mental health population, a low income population. Mostly, what I do is I connect members or clients to their community resources. So pretty much have them get connected to like services pretty much in the community. And the main goal is improving the mental health and the well-being of the individual, and also improving the social determinants of health, such as housing, transportation, food, and also access to care.
Oh, nice. So let's just kind of dive in a little bit and let's talk about what is the true definition of mental health as you see it?
Yes, mental health. So it refers to our emotional and psychological state. So it's pretty much our social well-being and how we feel about ourselves and how we interact with other individuals. So it's pretty much if our well-being is not in the right place, like we're not happy, we are not eating right, we're not sleeping right, we're not doing the things that we enjoy, then that can actually affect our mental health status. And we get to feel very not ourselves.
Yes, especially right now because, with everything going on with the pandemic and people are working from home, we are seeing an increase in suicidal rates and depression, not only among adults, but also among adolescents as well.
That is correct.
Yeah.
Especially during this very tiring time, it has been really stressful, and a lot of people are a lot of people are usually like socially isolated like before, but now it has been like increasing, and it has been really difficult. They can't really go places. Most people that have been engaged to like their like religious places like churches or mosques or any other religious places that they can go to, they're not able to go. Support groups are pretty much like on lockdown right now. They're not able to go to support groups, and they're mostly online. And it can be a challenge because some people cannot have like internet access. They're not able to like go online to do like those support groups or access Zoom. So it has been really difficult.
Yes, because you can't even go to the public library to use the internet right now, like most people would do if they didn't have internet access at home. So I
That is
know for me personally, I would go to Starbucks cafe just to kind of sit down, have a nice cup of coffee, do my work on my computer a little bit just to kind of get out of the house. But you can't sit inside anymore. So you have to go through the drive-through when you want to go to Starbucks.
Yes, it has been really difficult, and the things that we used to do has been limited, and a lot of places are not open right now. And this is for health, benefits. We're not able to go, but it has really put a toll on people, especially like I would say like the elderly population. They have really been struggling. Like sadly, a lot of my clients, they're like elderly, and they have just been really having a difficult time. They're not able to go places, and like transportation has been a barrier for them as well. Like
Mhm.
transportation that they used to have has been closed, or they're not able to utilize that. So it has been really tough for them. And
Yeah.
like I said earlier, a lot of them don't have like internet access, and so it's just face to face that they used to do, and it has been a very big challenge.
Yes, and now your family members can't just come over whenever they want. I mean, even Thanksgiving was a little bit off this year because they were recommending not to have a large Thanksgiving feast at your home. So a lot of people didn't get to come home and spend time with their family like we're used to doing. So I know that has been a huge challenge as well. What would
Indeed.
you say are some of the common misconceptions of mental health?
Yes. So mental health is a very important topic, and sadly, it's usually overlooked. A lot of people are not very familiar with it. Some of the misconceptions I can just definitely think the top of my head is just that mental health, it happens to weak people. Mental health, it's hereditary, it's genetic. Um, People who go through mental health, they either have issues, they have problems, something's wrong with them. That's
Mhm.
what the misconception is, which is totally not true, because mental health can happen to anybody.
Yeah.
Well, we all can have it. Anybody's challenges that we face in life, stressful situations, like working from home, that can be really difficult.
Especially if you got
I
like
have
4 or 5
had a
kids.
challenge with that. I've been having issues with that, and it's just really difficult because you're just at home, and like I'm not able to see my clients face to face, and this is something I'm really used to doing. So it can really play like that's a challenge, and it's like something it's a new thing that I have to do now, and it's just that's a mental health thing right there. So it's just a lot of things, and many people think it doesn't happen to them.
Mhm.
They mental health is something, oh, it's far away from me. So, which
Right.
that. Hmm.
Yeah, a lot of people think that it can't happen to me. I have a supporting family. I have this, I have that, I have a nice job. So it's not likely to happen to me, sort of say.
Exactly. Even though we do have supporting families, we do have a good job, but situations do happen in life. Like example, like when we lose something, like we lose a job loss, that can be a challenging situation. Sometimes that can, we can face losing someone that we love, a friend, a family, just change in life can be difficult, and that can be a really big problem, and we can all go through it. That's a mental health problem because we're not able to cope with the new change that we have.
Yep, definitely. My friend sent me a video today. A young guy, he posted a video on TikTok, and he actually shot his girlfriend and he shot her mom. And he was on TikTok, like recording
Wow.
it and crying and like, spazzing out. And then they say he turned around and killed himself shortly after that. So, what are your thoughts on that?
My thoughts are he was definitely crying for help, and he didn't get the help that he was needed. Most of the time, the people that he was around, like his loved ones, his friends, his family, they were not able to support him. They were not able to understand what he's going through. They're not able to be that support system that he needed. Because most of the times that people that go through mental health, like depression, anxiety, or bipolar disorder, or just when you're going through like a challenge, like something that's challenging in life, and you're trying to explain it to your loved ones or someone they trying to explain it to them. The thing is, I think that makes individuals who are going through it very hard for them because the other people are not understanding it. They're not getting it. I think that's what happened. He wasn't able to get the help that he needed, and unfortunately, he that was the only way out. He felt like there was no other way out.
Yes. Reginald said he called the crisis hotline. They put him on hold and they said they'll call him back. And he
Mhm.
asked, how do you get the help when you need it?
That's tough. That's very tough. I can definitely understand how difficult that is when you're crying out for help and you're not getting the help. But I'm sorry that happened to you, but definitely that's not going to be all, the situation. You have to ask for help. You have to. If this happened one time, this is not going to be the way how it's work out. You have to always seek help because it's available.
Hmm. And if you do call a number and that's what they say to you, look out for, I would say, research it and look for a different number to call to see if you can get in contact with someone else, or even hang up and call again, because
Hmm.
that is unacceptable.
No, it's not.
And they could have,
It's
maybe
not
it
good at
was
all.
busy, maybe they had a lot of stuff going on that night, but that to me is just absolutely unacceptable, especially, at a point in their life where they just need help immediately. You know what I mean?
Mhm. Exactly. Exactly. And that just reminded me of something. I do have a lot of clients that I help. Sometimes they do have crisis situations and things in that nature. So I do take those really seriously because you never know when is that one time that you just don't know. That might be that time because I do get those calls that, they're just because they're feeling suicidal, they're feeling homicidal and they're having thoughts. And I'm getting like maybe like three or four, four calls, maybe like a month.
Hmm.
Take it seriously because you never know when is that time will come. So you just have to always make it, priority.
Yes. What are some signs that you look for to determine if a person may be suffering from mental illness, either for themselves or maybe for a family member?
Yes, definitely. Some of the signs are just like the really important one that you can see right off the bat is pretty much just not being able, like not having the passion or even like the not being able to just get up out of bed, just doing the regular chores that we do every day, like cook,
Mhm.
clean, take a shower, go out for a walk, talking to people that we love, like some small things like that can be really a red flag. And some things that are just isolating ourselves. We're not around, we're not available, we're always like anybody call us, we're not answering. Those are really other signs as well. Just not being able to do anything, not having the passion, not having even the what is the word, like the power to just get up to do something. Anything that we used to enjoy, we just don't want to do it anymore.
Mhm. So, how would you recommend that they kind of address that? Especially, well, I'm going to say, how would you approach a person that you suspect has been suffering from mental illness?
The one
Yeah.
thing, yeah, the first thing is to go ahead and talk to them. Just talk to them, in a really like just like important way. Just honestly, just being honest with them and just tell them, lately I have been seeing some changes. You are not the same. You used to do this, you used to do that, and now things have been changed. So, what's going on with you? What is it? Are you feeling like what's happening? Just have a conversation with them. And some of the times they'll tell you what is it they're going through. Some, they will tell you exactly what's happening. And if they hear it from someone they love, like a really like good support system, someone that they trust, they will go ahead and like do something about it. Like example, if I see like my family member or friend that's just things are changing, like they're sleeping so much or they're not sleeping at all. Some things are changing, and just go talk to them and see what's happening, and I can refer them to go ahead and seek help, see a counselor, see a therapist. That's be really helpful, or go get diagnosed, which is another thing that it's really important to get diagnosed, and to see what the issue is, so that way they can get back to their normal routine.
Yes. And I would also recommend to also be cautious about how you approach them,
Hmm.
because you don't want them to kind of get defensive.
That is correct. You do have to be careful with that too. You're right. You do have to be very cautious, and you have to just kind of set boundaries and just talk to them and not push them. You have to be able to just ask them, and if they're able to tell you what's going on, then that's good, but just not push them and want them to keep telling you what it is that they're going through. Because sometimes they're not really feeling comfortable, or
Mhm.
they're not to that point yet where they're able to tell you what's going on, or what is it that they're feeling.
Right. Or sometimes they're not even ready to kind of
That is
open up
correct.
to seek help
That
until
is correct. That is correct. And that actually reminds me of talking about trauma. A lot of people go through trauma. Those
hmm
situations are very difficult to deal with. It's like traumatized situation in their life that they have been going through. Like those things are really difficult to talk about. It takes time. It's really difficult, even if the family member, they're not able to discuss this with a family member. So it really takes a lot of times. And it's not that they don't want to tell you, they don't want to share that with you, but it takes time to discuss that information, and for them to even, because they think about it, but they can't even say it out loud to themselves. They have to be able to say it to themselves so they can share that information with their loved ones.
Yes. Someone asked, why do a lot of people dealing with mental illness say that they don't need their medicine and will not take it anymore?
That's a good question. I would say a lot of people do not want to take their medication. Many of them feel like their medication might, they feel like they might be addicted to the medication, and they don't want to keep taking something that they will be addicted to. And some people might feel like they don't have any mental illness and they don't need medication. So what's the point, if they're not feeling like they have any mental illness, or they have any diagnosis that needs to be treated by medication, then they're not going to be taking the medication. They just
Yeah.
don't feel it's needed.
Yeah. And I think too, a lot of people, when they do take their medications, they don't like the way that it makes them feel. Like some medications, kind of make you feel loopy, or they make you feel like you can't really function. And I know some people don't really like feeling that way.
That is correct. A
And
lot of that is correct. A lot of like medications for like depression or anxiety, they do have side effects of like making you feel very tired and sleep a lot, and sometimes they make you stay up late. Like you can't even sleep sometimes at night. So these kind of the signs, they don't wanna take them because of that as well. That can be a barrier.
yes, definitely.
Or
And
even eat a lot as well.
hmm so I always tell people that when they do get their medications, always double check the side effects. And when you check the side effects, pay attention to how it makes you feel personally. Because if
Mhm.
it does make you feel sick or nauseated or give you headaches or make you, dizzy or anything like that, those are things that you want to be paying attention to so that you can bring it to the attention of your psychiatrist or your personal your primary care physician so that
Mhm.
they can either give you a different medication or they can find another way to get help for you, if that makes sense.
That's a great point. That's a really great point, because not every medication would work for everyone. They do have different side effects, and some of them might work for this individual and the other ones might not work for this individual. So it's really
Right.
they connected with their primary care provider, with the psychiatrist, to let them know about exactly how is the medication making your body feel. So that way they can make some changes accordingly. And also sometimes, like when your body gets used to a certain medication for so long,
It
it,
stops working.
yes, exactly. So so that might be a really great point, just to discuss how long you've been on medication, and they have to make some changes to another medication that may be able to help with the things that they're feeling.
Yep, that's so true. And also, too, they have to be mindful of substance abuse as well, because a lot of times when people go undiagnosed or misdiagnosed, they don't realize that they have a mental health condition. It can lead to substance abuse problems, whether it's, they originally had back pain
Hmm.
and, they start taking the opioids that the doctor prescribed and now they can't get off of them. And so, you want to also be mindful of that as well.
That is correct. That's a really good point.
So, what are some ways that outside of the medication, outside of seeing the psychiatrist or the psychologist, what are some ways that you can cope with mental illness? Like, are there exercises that they can do at home? Is there some kind of, strategy or something that they can do to kind of, mellow them out a little bit?
Yes, yes, yes. There are a lot of things that people can do to cope with mental health, with the depression, with the diagnosis that they're going through. So pretty much they can practice mindfulness.
Hmm.
They can practice deep breathing. That can be a really good one. That sometimes the therapist can actually work with you on that. How important it is. Like if you feel like you just can't take it anymore. Like it's important to just sit there, take some time to breathe, couple of 5 to 6 breaths, and just be just calm, and that helps a lot.
Hmm.
Breathing, mindfulness, and also support groups can be very like helpful. They do have different support groups. There is the NAMI, the National Alliance of Mental Illness. They have great support groups for depression, anxiety, and bipolar disorder.
Hmm.
The support groups are people who are going through it. So when they're able to, go to the support groups, you can talk about the issues that you're going through, and you don't have to feel ashamed because it's everybody around you that's it's going through it, and everybody can talk about it, talk about what they're feeling, and talk about their emotions and validate their emotions. That helps a lot with coping with mental illness, and also talking to the therapist or the psychiatrist. That's a really good one. Or talking to the counselor. Some other ways. Self care is a very important one. So
Hmm.
just sometimes we take so much, like we do so much, and we just can't even have like enough time for ourselves, or even like small, like 10, 15 minutes to ourselves to do things that we really, really enjoy. Like going out for a walk, listening to music, you just, you know, take a hot bath,
Hmm.
really help our mental health status and make us feel better. So these things are important. Self care is very, very important one that I wanted to discuss today.
Absolutely. And something I found that was very interesting is that even young children may show early signs of mental health concerns. And it's often clinically diagnosable, and it can be a product of like psychological or like social factors. But one thing that I found was that mental health disorders kind of start showing up, I want to say right before the age of 14 years old. So definitely, the beginning of the teenage years. I want
Mhm.
to say make sure you start paying attention to your child. Make sure you start paying attention to their habits, what they're doing at home, things that they're putting in their minds on a regular basis. You know what I mean? You kind of want to monitor that because, especially nowadays, we always just give our kids the iPad or the TV, and then we just let them watch or do whatever they want to do. So I
Mhm.
would recommend, get into your kids' business, learn a little bit more about what they're doing, what they're watching, what they're listening to, and other things of that nature.
I agree. That's a really important one. And it's very important for us to be able, like you discussed, Dr. Gloria, to be able to have our kids to just have that social interaction with them. Just be there with them, talk to them, and just see what's going on. Because a lot of them now are all on social media. They're all stuck on their cell phones, and
Hmm.
there's no interaction, there's no communication in the home, and that can really that can be the start of something once they start growing up. So it's very important for that social interaction at the house to be able to just do like board games again, like play with the kids, do some board games and coloring, do some puzzles, all that stuff. It's really important.
Yep, definitely.
Mhm.
I know one misconception is that people with mental health needs, um, that they can't tolerate stress or they can't keep a job and different things of that nature. But you can be functional with mental health. And I think a lot of people don't really realize that. There are people that are working in the cubicle next to you that may be in a deep depression, that
Mm-hmm.
may be bipolar and not diagnosed. They may be schizophrenic, you know? So a lot of us, when we think about mental health, we're like, oh, it can't be this person because they're always at work. They're always getting their work done. But a lot
Mm-hmm.
of people are suffering in silence. And so we have to make it a point to, I don't want to say get into the next person's business, sort of say, but, ask them how they're doing today. Ask them if they need anything. Do small things to kind of make their day go a little better, because you never know how big something so small might be, to make their day or to make them feel a little bit better about themselves.
That is true. So we have to be able to normalize mental health. That's, I think, the one thing that we all can do. We just have to, the more we talk about mental health, the more people are able to discuss how they feel. They'll be more open about it. They'll be able to discuss the struggles that they're going through. Because if we feel like if we're just not talking about it, that's why it's like a taboo for people to even
Hmm.
discuss mental health. A lot of people are just feeling like, oh, I don't have any mental health and I don't want to talk about it. That's why they're struggling in silence, because the society, it just puts a stigma, around it. And like you stated, just has a lot of misconceptions. And people who have mental health, they're unable to do this and able to do that. And it's just so many bad things that are just said. And we have to work on it. We really have to, as a whole, we have to normalize it and we have to talk about it.
Yeah. What are some of the resources that are out there for people that are suffering from mental health illnesses?
Yes, the National Alliance of Mental Illness is a really great website. They have great support groups for depression, for anxiety, and what you people can do is go on their website, and you can actually find support groups depending like on different states. You can choose the state that you're in,
Hmm.
choose what support groups you'd like to attend. At this time, everything is done like via Zoom,
Hmm.
a pandemic and everything, but like when things go back to normal, like they used to have like in-person support groups, which can be very helpful.
Yes, that would be nice, an in-person support group.
Mhm. And also there is the Depression and Bipolar Support Alliance. That one is a really great resource as well in finding support groups. Also, the EAP is a great one as well, the Employment Assistance Program.
Hmm.
A lot of like employers, they do have that. EAP is a great one because they do help individuals with like connecting them with resources and make sure that their well-being is in the right place.
Hmm.
Sometimes they can allow you to have like a certain amount of like therapy sessions or counselor sessions, which is can be really helpful. It would be great to utilize.
Yes. And so that's EAP, Employment Assistance Program.
Program. Hmm.
I know another great resource is the Depression and Bipolar Support Alliance. So if you feel that you are suffering from depression, or if you feel that one minute you're cool and calm and the next minute you're on 100, definitely check out this website, okay, you guys, so that you can get the resources that you need. Also, if you are suffering from substance abuse, if you know somebody that is, abusing alcohol, on, cocaine or meth or whatever the case may be, another great resource is the Substance Abuse and Mental Health Services Administration.
Hmm.
So that is the website that you will go to, as well. If you are someone that has been contemplating suicide, the first thing I want to say is don't do it. The world could be such a better place with you in it. Okay? So don't do that. But if it's something that you are pondering, you feel like a lot of stuff is just constantly against you, you can't, focus, you can't do anything, you can't, mentally get where you need to be, the suicide prevention line is 1-800-273-8255. But I
Yeah.
do recommend that you get a therapist.
Mhm.
If you feel like you can't talk to people around you, get professional help so that you can at least get your thoughts and your emotions off your chest. A lot of people, I think, sometimes just hold everything inside, and I think that just kind of overloads them,
Mhm. Mhm.
and they don't know what to do after that. So definitely, if you don't have family members or close friends that you can talk to, definitely reach out to a professional, so that you can really get the help and the assistance that you need. Because a lot of times we have a lot of stuff going on, and it happens to all of us. You might have lost
Mhm.
a job. You can't pay your rent. You can't put food on your table. You can't pay your utility bills. A lot of people experience this. It is not
Mhm.
the end of the world. And even though it seems like everything is going bad right now, there's always what they say, a light at the end of the tunnel. And there are resources out there. You just have to research them and ask the right questions. Like if you can't pay your utility bill, just go on Google utility assistance, type it in, and see if anything pops up where you can put in an application so someone can help you cover your utilities. You know, if
Or
and
also, I'm sorry, Dr. Gloria.
okay.
Call 211. 211 is a great resource for people to call if they need like assistance with paying utility, financial assistance with rent, like food, like you find a food pantry near you.
Mm-hmm.
You can just go dial it on your cell phone. You don't have, I don't think it works on like home lines, but yeah, on your cell phone, 211. And it gets you connected with someone, and then they'll ask you for your zip code, and then they'll ask you what is it that you need help with, and they'll get you connected with the resources, let you know places that you can go that service your zip code.
Mm-hmm. That's awesome. What are some interesting resources that you guys have there in Dallas, Texas?
There are a lot of resources. So we food pantries are have been really like a great help right now for people who are struggling, especially during this pandemic. Things have been rough for a lot of people. It has been really tough. So food pantries have been really helpful. Like any food pantry you can go to, like they do service by zip code, but they do have like drive-through food pantries. You can go to any of them. Like you don't have to sign up. You just have to have like your ID and show a proof of address. You can just go get some food. Doesn't matter how many times you can just go. And there's like places like Salvation Army. There is different places like Jewish Family Services. They do have utility and rent assistance.
Yeah, I know in Montgomery, we have the Montgomery Area Food Bank, and sometimes I volunteer there to like package the food in boxes and stuff like that.
Mhm.
But there are so many food pantries around here, you guys. Like when I say so many, I passed by one the other day and the line was wrapped around the building. Okay.
Wow.
Yes. So I know definitely here in Montgomery, there are a lot of resources around here. If you do need help with food and resources and stuff like that. Miss Sullivan said a lot of times that a lot of people don't like the way that the meds make them feel, and we kind of discussed that one.
That's correct.
Yeah.
And
Yeah.
I want to mention, since we actually brought like food pantries, some of the way for for us to just if the, we feel like we need to like do things that we enjoy, we can volunteer.
Mm-hmm.
Volunteering is very, can help a lot. Like if we're dealing with things and sometimes we are socially isolated, we can volunteer. We can volunteer at food pantries. We can volunteer at the libraries. Pretty much places that we have interest in, and that actually helps a lot. Just being out, out of the house, just not being isolated, all the time.
Yeah. And then if you volunteer, they'll even let you keep a bag at the end.
That's a plus.
Yeah, can I get some cereal over here?
You can keep it back and you can make friends as well.
Right. But the last time we went to a pantry, I took my daughter with me, and I was like, you need to serve people. You need to understand what it feels like, you know. So I do recommend, taking your kids with you so that they can, just serve people and get in the habit of serving people, because they need to understand you may have it good, you may have an iPhone or iPad and all this other stuff, but there are people that don't have the things that you have. So you have to be appreciative of what you have. And I try to teach that to my daughter. I hope I'm doing a good job as I kind of side eye her over there.
Yes, you are.
I hope I'm doing a good job with that. But yeah. So, what are some other things in regards to mental health? I know we didn't really talk too much about substance abuse, but do you get a lot of clients who are suffering from substance abuse?
Yes, I do. I'll say like 30 to 40% of the population that I serve is substance abuse. And most of the times, it's similar to mental health. It's just overlooked, and sometimes they're not taken seriously, and people just look at them as, oh, they're just never gonna get better. They're addicted. Whatever you do, they're not gonna get better. But people can go to get detox centers,
Hmm.
to a treatment facility. Like they have 30-day treatment facilities, or 2 months detox centers. And most of the times, like, insurance companies do pay for it. Like, not all of them,
Hmm.
some of them do. So you just gotta know, ask an insurance company and see if this is something that they will be able to cover.
Hmm.
They can go ahead and get the help that they need.
Yeah, and they should be able to check their insurance coverage online as well.
Yes.
I know one thing that I've noticed is when a lot of people kind of suffer from mental issues, a lot of times is due to a hormonal imbalance that they don't realize that they have.
Hmm.
And you can get blood work done, of course, through your primary care physician. Have them check your blood work to see if your levels are okay. Are they balanced out? Is there an underlying condition that you're missing out on that you have not, paid attention to, or even has been brought to your attention? But definitely take that into consideration as well.
That's a really good one.
Have you noticed that too? Is that something?
Actually, I haven't. So that's why I'm like, oh, this is a really interesting one.
Hmm.
It is. I learned something new today.
Yeah. So, let me see. Do you have only adults in your practice, or do you have a combination of adults as well as children as well?
At this time, it's only adults. It's only adults. I can say the primary, like, people that I serve, it's like elderly, maybe like 70% elderly, and the rest can be like 30s and 40s and 50s. Hmm.
Yeah.
Yeah, I wouldn't serve children yet. Interested in, because yeah, children, they do need the help too. They really do, because they do go through it, and a lot of times they are socially isolated, and they're just not out there they're not doing things, and they're just inside the house, and that can really mess with their mental health.
Yeah. What is something that you want the general public to know about your profession and about mental health in general?
Yes, some point that I want people to take today from this talk is mental health is a very important topic, and we really all have to do our best to normalize it and talk to our loved ones about it at home, like, just make it something that it's open. So whenever someone's dealing with something in the house, they're able to come to you and talk to you about it. And another thing that I just want people to take away from it is to go ahead and become familiar with mental health and just become familiar with depression, anxiety. What is it? What does it do to the body? Like, what is it all about? Because I know if it's not something that you're going through or your family's going through, might be one day your friend, someone that you really care about might go through it. So then that way you'll know how to deal with it. You'll know what to do, because if you're able to just sometimes like people who are going through mental health just want someone to listen to them. Just have an ear to listen, validate their feelings. Just make sure that you're there for them. A lot of times we make the mistake of just not listening to people who are, going through things. Like they can tell you, oh my, I'm so tired, I'm so tired of everything. And let's say they keep doing the same things every time. You're just like, why you keep doing this? But you just want someone to listen to them.
Right.
Like, you don't want someone to, like tell them, oh, but you shouldn't be doing this, you should be doing this. They just want someone to listen. Just pretty much have an ear and just validate their feelings, and that will actually make them feel better. Just listen to them, and reflective listening is very important. And this is one thing that I learned like throughout my working time in behavioral health and mental health. Reflective listening, validating people's feelings, that just goes a long way. Like a lot of my members, like literally sit there and talk for like an hour, and then they just sit there and like thank me for just being there listening to them. And
Mhm.
that's what I'm here for. And they say, oh, I feel so much better just talking to you. Like I feel really great just having someone to listen to and care for. So that's is a really rewarding feeling.
Absolutely. Well, Miss Salma, I just want to thank you so much for blessing us with your presence today. Thank you
Thank you.
for the information and the resources that you have given us. And I hope that these resources can also bless some of the people that are viewing tonight. I will put the links of the websites that we left you guys with and the phone numbers in the chat as well. I also want to say, make sure you guys tune in next week. We have Dr. Velma Scantleberry, and she is the first African American woman transplant surgeon.
Wow.
So we will be
That's
interviewing
big.
her next Monday at 7 p.m. Central Standard Time. So make sure you guys tune in. You do not want to miss this. Okay? I hope you guys have a blessed night, and I will see you guys soon. Good
Thank
night.
you.